If you've ever felt like your health is being treated like a line on a spreadsheet, outcome divided by cost, you're not wrong. That's literally how the system defines value. The problem is, that's not how you experience value as a patient. I'm Dr. Tyler Goldberg, orthopedic surgeon specializing in concierge hip and knee replacement, and for the last 25 years and 12,000 surgeries, I've seen patients literally transformed physically and mentally. I'm on a mission to transform the way the world experiences joint replacement. Ready? Let's hit it. How healthcare thinks about value. When people in healthcare talk about value, they usually mean one equation, and it came from Michael Porter at Harvard Business School. He defined value as value is equal to the outcome divided by the cost. On the surface, it sounds reasonable. Better outcome in the top number, lower cost in the bottom number, higher value. High outcome, low cost. So high outcome, low cost equal high value. That might be fine for products or business models, but for people, for surgery, it misses a lot. There are a few big problems with this equation, outcome divided by cost. First, value is subjective. Being able to walk around the block is a great outcome. For another, that exact same result is a disappointment because they wanted to run 5Ks. Same clinical result, two totally different experiences of value. Second, outcomes are hard to measure cleanly. There are dozens of scoring systems. Some are based on what doctors think, some are based on what patients report. Which one is the truth? Cost is messy. Take a patient with multiple medical problems who needs more resources, maybe more pre-op workup, a longer hospital stay, but still ends up with that fantastic result. On paper, they're low value because their denominator is high, their cost. In real life, that surgery might have kept them from a nursing home or independent for another decade. Finally, our system is fragmented. Every hospital, clinic, imaging center, and rehab group has its own little slice of the equation. Nobody sees the whole picture the way you experience it as a patient. When you build policy and payment around outcome and costs, something predictable happens. The system obsesses over lowering the cost. We don't want this, we want lowered cost, right? Value becomes a race to the bottom on price. Care gets treated like a commodity instead of a relationship and a process. That pushes competition over collaboration, but in joint replacement, collaboration, surgeon, anesthesia, physical therapy, nursing, you, is exactly what produces great results and great value. So the system's version of value and your version of value often don't match. I like a different way of thinking about value that comes from entrepreneur Alex Hormozi, who talks a lot about customer success and perceived value. His definition looks like this. Value is equal to the dream outcome times your likelihood of achievement divided by the time delay times your effort or sacrifice. Same thing. I didn't make that up. That's just Hormozi's framework. I'm just applying it to joint replacement because it maps out almost perfectly what my patients actually care about. Let's translate it into plain English for someone thinking about a hip or knee replacement. First, your dream outcome. Dream outcome is what you want. Walk without pain, sleep through the night, get on the floor with the grandkids, traveling again. That's what you get into this whole game for. Then you have your likelihood of achievement. How confident you can be that your surgery will actually get you the results that you want. How confident are you that you'll get there? This is divided by the time delay, and that's how long it takes from deciding to act until you get your life back. This includes the time waiting for surgery, time recovering for surgery, until you live your dream outcome. Finally, there's the effort and sacrifice. How much pain, logistics, and rehab grind will you go through to get there? True value from a patient's perspective is big dream outcome, high likelihood of success, short time delay, and less friction, right? Less chaos, less sacrifice than expected. You want to maximize these and decrease these, and that gives you big value. If you're sitting in pain right now, thinking about a knee or a hip, here's how this probably sounds in your head. I want this to work. I don't want a maybe. I don't want to wait a year to even get my surgery. I'm exhausted. I don't want miserable, confusing recovery. You want to increase the likelihood of your dream outcome. You want to decrease the time delay and decrease the effort that it takes to get there. And that's exactly what you should want. That's what real value feels like on the other side of the surgery, when you're walking, sleeping, traveling, living again. There's an important nuance here that isn't accounted for in the other equation. I don't create your dream outcome. This comes from you, what you want your life to look like. It's personal for you. What I can influence as a surgeon are these three other parts. First, your likelihood of achievement. A surgeon who's done thousands of these operations, who lives in this world every day, who studies the details and outcomes, can usually give you a higher chance of hitting your dream outcome. How about time delay? How long does it take to get in to see your surgeon? How quickly can we move from decision for surgery to clear once you're a candidate? How about your effort or sacrifice? That comes from surgical technique, pain management strategy, how well your recovery is planned, whether you're trying to coordinate everything yourself or we've already done it for you. That's where training, repetition, and system design come in. And that's where my concierge model lives. I didn't build a concierge program to make things fancy. I built it because I wanted to directly influence the parts of the value equation I can actually control for you. 1, 2, and 3. I can increase the likelihood of achievement by limiting volume so I'm not operating exhausted, by planning your case like it actually matters, because it does. Decrease the time delay by shortening the gap between I can't live like this and I'm on the schedule. By cutting out as much unnecessary back and forth as possible. I can decrease the effort and the sacrifice. I can do this by having the right equipment, the right pathways, and support in place before you ever even get to the operating room. I can make your rehab focused and clear, not chaotic and confusing. That's what concierge means in my world, not champagne and slippers, just a higher value path from I'm stuck to I have my life back. So when you think about value in hip or knee replacement, I don't want you to picture some spreadsheet at a hospital where you're just an outcome divided by cost. I want you to ask, what's my dream outcome? How confident am I that this surgeon and this team can get me there? How long is it going to take me to drag this on? And how much extra pain, confusion, and sacrifice is built into this process? If those answers are good, that's high value, which is what you want. If they're not, it's worth asking whether you're in the right model and with the right surgeon. Want more on hip and knee replacement, recovery, costs, and real patient stories? Check out the playlist below. If you're trying to figure out your own next step, start with the joint quiz and contact page in the description. That's the best way to get connected with me and my team. If this helped, please like, share, or subscribe for more straight answers about hip and knee surgery.